I want to ask you about modern tools for modern problems, because you look at the human body now and some of the things that get lodged inside of it, some of the pharmaceutical products and different things that people have in their bodies that create these obstructions. It's I know that you use powerful herbal formulas that can affect the body in a way that just the fruits can't. What about, for example, I've seen a lot of enzymes being used. What do you think? Is there a downside of that, or a potential risk, or what's your view on enzymes? Because I'm seeing a lot of people taking enzymes and so forth.
I like I said, I've been a naturopath 50 years, and I've lived through, my God, everything. I've lived through supplements. I used to have vitamins and minerals in my name. I've lived through everything, but I've always been fruitarian thinking. Yet when I opened up my first health food store in, I think, 1971, and I'm starting to eat out of it. Oh, this is good. These nuts are good. They're natural. They're raw. Oh, look, raw milk yogurt. I got raw goat's milk. That's all good. And I started getting my mucus back. I started feeling bad again. I'm going, what? These are all healthy foods. Tiger's Milk Bar, health bars, and all. No, not at all. And now most health food stores are candy places. And it's like, really? No. And so that you have to grow out of that and learn that there's all this. There's drinking your urine, there's taking turpentine. You go down a long line of treatment, and why it exists is because man doesn't understand the lymphatic system or chemistry. He doesn't understand why he's suffering. He's grabbing at straws to help him, and you don't have to grab to those straws because some of them are toxic as hell to you. I'm military. We don't drink urine in the military. And it's like, these are some of the things you don't add, particularly if you're filtering. If you get your kidneys filtering, this is all the waste from your cells that you're re-drinking, and they're acids. Tell me where that's healthy. Explain to me where that, and it's not. And it's like, and then there's the turpentine or whatever it is. And then there's, I can go on and on. Beta glucans, 3D, 6D, 9D glucans. You can go on and on and on about all these treatment-based thinking that's individual constituents, enzymes, the digestive enzymes. I've had a saying for years that I learned when I watched all this happen. If you take it, your endocrine glands quit making it. So if you take a steroid, your adrenals just sit back.
Right.
So one of my patients said that to an endocrinologist once. She said, I can't take these steroids. It's making my adrenal. She said, yeah, it shuts them down, but they're just going to sleep. They'll wake up stronger. That's what he told this lady. And it's like, really? Where'd you learn that? That is just cookie stuff. You want those cells in your body to perform. You don't want to give what they need to do to feed them, thinking that that'll make them perform better. No, it doesn't happen that way. What you give the body perceives and will shut down.
Okay.
It doesn't try to overdo it. And the problem with supplements, you can overdo it with calcium, phosphorus. It's all over the place. You take supplements, start reading how many calciums you're taking, phosphorus you're taking, and all this. And it's just a miss. Then you've got utilization factors, which is adrenal mineralocorticosteroids. You've got a whole line of everything else going on in agglomerated bodies. And all you got to do is clean them out, turn the cells back on, and understand that your foods also come from the divine. They're conscious. These herbs are very conscious in what they do. They'll go in and start straightening things out. You're hydrating, which will detox the body. All these neurotoxins, excitotoxins, all these things will come out. The sulfurs are a little hard to come out, and neurotoxins are a little hard to come out, but they will come out.